So we're talking about cochlear implants, which is this marvelous bit of technology which allows the recipient, child or adult, to be able to hear and deliver sound from the ears to the brain, where they're going to be able to understand this sound. Now, to be able to do that, it's imperative that we have to bring in the skill sets and the expertise of multiple disciplines. It's not just the surgeon or the audiologist who's going to do that. We have to have the appropriate medical, audiological, habilitative, and support people together in the cochlear implant team. The power and the value of this team approach is integral if we really want that the cochlear implant recipient is going to get the best out of his or her device. And that is how our team functions right from the time of diagnostics to evaluation to the treatment and the follow-on at every step to ensure that the recipient and their family gets the power and the expertise from every faculty in this multidisciplinary team approach for a cochlear implant.
We just now heard that cochlear implant is a multidisciplinary approach and we require a team. And now we come down to the process. Once we establish the child or adult is a cochlear implant candidate, we start the extensive evaluations, be it audiological, radiological or medical evaluation. We have to ensure that the process or the intervention that we are taking this child or individual, we have to ensure that we get the best result out of it. Therefore, the extensive evaluation is needed. And then, along with the evaluation comes several meetings. And we like to conduct meetings jointly, and we call it joint meeting, wherein the surgeon, audiologist and therapy team sit together and understand, go through the entire process, explain the family what is a cochlear implant, what this intervention means, how much the result will be followed. So once the parents or an adult family, they are ready for cochlear implant, here comes the most awaited process, that is the surgery. Here is the internal device that is implanted by the surgeon, and then after 2 to 3 weeks, the external sound processor is switched on, and at the time of switch on, that is the most exciting part of the entire journey, where the child or an adult actually gets to hear the sound for the first time. And then the journey begins after the switch on process. They are hearing, who were just not hearing anything. And then giving meaning to the sound comes. And that is the habilitation process, which is taken by the habilitation team. And sometimes speech therapies are required for small children to provide them language and speech. This entire journey of listening through cochlear implant, understanding meaning through cochlear implant, and learning language and speech may take anywhere between 2 to 3 years for a small children, because language takes time to be learned. Otherwise, all the children born would have been speaking. When the normal child takes 2 to 3 years to speak, so does a cochlear implanting. And this entire process, they are supported with audiologist, speech language therapist, habilitation team, and we are happy to have a surgeon on board who often, even after cochlear implant, comes for joint meeting to understand some of the burning medical issues that they may be facing. And this is a journey and the process of a cochlear implant recipient.
You've heard about the team approach for a cochlear implant. You've heard about the journey that a cochlear implant recipient has to go through. But not every team is the same. What is critical is that you've got to ensure that every member of that team is appropriately qualified, trained, and has the experience and the skill set to deal with the unique and subtle nuances of that child or that adult's condition, because every person is not the same. right from diagnostics, an experienced audiologist who has a vast plethora of experience to understand the nuances and pick up the type of hearing impairment that the child or adult might have, a surgeon with experienced hands who can tackle every type of complex anatomical or structural problem, both understanding it before the surgery and taking care of the steps during the surgical process to ensure that this delicate cochlear implant is inserted in the inner ear without trauma, preserving the hearing structures safely without giving the risk of infection. You need an experienced habilitation team supervised by the senior audiologists to ensure that that child or adult is on the right track. Constant monitoring, because sometimes things may not work out the way we want. So to be able to immediately change tack and decide on a different approach. The constant interaction between every member of the team, not just before the cochlear implant, but even after the cochlear implant activation or any time during the lifetime of the recipient, is extremely vital, so that this constant dialogue between the various members of the team can flag up any problems and prevent any issues that might occur. So every professional may not be the same. You need to look out for a team that has an extensive degree of experience, well qualified, who've handled a variety of different problems, who come together and work cohesively and are committed. It's extremely important that the team must be committed for the lifetime of that cochlear implant recipient if we really want to ensure that the cochlear implant recipient gets the best out of his or her device. So we as a cochlear implant team believe very strongly that not only do we have the right qualifications, immense experience and exposure for decades in the treatment of cochlear implants, be it the surgical aspect or the audiological aspect, but we believe that we have the passion, the dedication and the commitment to our patients who seek treatment for hearing loss. Whenever we see a child or an adult with hearing loss who comes to us, potentially for cochlear implant, for us it's not just about another surgical procedure or just another switch on or another mapping. It's about how can we change or help change the life of that recipient, not just for now, but for the rest of his life. That's the passion, the dedication and commitment our team holds. It is such a delight and so heartwarming when we as a team see the children who we had implanted many decades ago as little babies come to us when they are in higher education, for example, during their continued monitoring and visits to the clinic for evaluation, mapping, or validation of their hearing. That's the commitment, that's the passion, and that's the dedication you need from a good cochlear implant team.